Hello everyone, welcome to another brand new class of human physiology. Let's recall what we did in our last class. We discussed thoroughly about various endocrine glands. We saw how pituitary, hypothalamus, pancreas, gonads, different type of endocrine glands secretes hormone and that play important role for maintaining various physiological functions of our body. In this class, we will discuss about glucose homeostasis. And also we will see if the glucose homeostasis gets disturbed, then what condition can develop in our body, which is called diabetes. So let's start it. So what would be the contents for this class? So first we will see about what is glucose homeostasis. Then we will also discuss about the importance of the glucose homeostasis in the body. Then we will see about regulation of blood glucose, factors maintaining the regulation of blood glucose. Then we will find out what are the different hormones that play important role for the regulation, and after that we will see if any disruption happens in glucose homeostasis, what will happen. The disease that will develop after the glucose disturbance will be called as diabetes mellitus, and the different categories of diabetes, for example type 1 and type 2, will be thoroughly covered. So what is glucose homeostasis? Glucose homeostasis is nothing but maintaining the blood glucose level in our body. And as you know, glucose is the foremost primary important component to produce energy in our body, and without the supply of glucose all the time to our cells and the tissues, the cells will be unable to form the energy that is so much required to maintain our healthy body functions. So and for this reason, all the time the glucose need to be maintained in our blood, and a proper supply of blood glucose should be always be there from blood to the cells and the organs. And to maintain this glucose balance, an important organ which is pancreas, that is primarily involved. As you remember, in the last class also we told that pancreas has two type of different cells. One is beta cells, which is also known for secreting the insulin hormone, and then the another type of cells which we have in our pancreas are the alpha cells, and alpha cells are important to secrete glucagon hormone in the body. So as you remember, insulin generally carries the blood glucose and distribute the glucose to various part of the cells. And also glucagon, what it does is whenever the glucose level is low in our body, glucagon helps to convert the glycogen which is present in the liver back to the glucose and maintain the glucose homeostasis. So that is why liver is also very important for glucose storage and release. As you can see that liver acts as a glucose reservoir, right. So if there is optimum glucose present in the blood, then of course that would be utilized by all the cells and tissue. But if we ate too much of food, then what will happen? Then we will have excess glucose, and excess glucose is never good for the body, because if it is always high glucose condition in the body, the glucose can disturb the cellular homeostasis. So body needs to convert this excess glucose. So in that case, what insulin does, insulin generally converts this excess glucose to glycogen and store in the liver. So what it is that insulin will convert the glucose and store in the liver as glycogen, and this glycogen can be stored for future use in case we are need of any glucose during a fasting condition. This glycogen then can get converted by alpha glucagon back to the glucose. So this is the way liver can act as a glucose reservoir. Okay, and this process of conversion of glucose to glycogen is called glycogenesis. Okay, so this process by which glucose is getting converted by the beta cell insulin secretion, this is called glycogenesis. Okay, and same way when glycogen is getting converted back to glucose by the mechanism of glucagon, which is called as glycogenolysis. So when the stored glycogen during the fast condition can get converted back to glucose, this is called glycogenolysis. And also you need to know this term gluconeogenesis. Okay. In this case, generally glucose formed from non-carbohydrate based sources. For example, it can be amino acids, it can be lactate, or it can be glycerol. So there are certain situations that from liver, in cases of lack of glucose supply to the body, or even if there is a lack of glycogen storage, in those time the glucose can also get produced from other source than the carbohydrates based molecule. So for example, like amino acids and lactate, by the process of gluconeogenesis can also develop glucose and maintain the glucose balance to our body. Okay. Same way like liver, in our skeletal muscle and adipose tissues also has role to play for glucose homeostasis. As you can see that muscle can store glucose in form of like glycogen, and this glucose can act for like ATP production. Same way adipose tissues also can store excess glucose in form of triglyceride. Okay, and this triglyceride can release like free fatty acid during the fasting condition. Okay, so liver, skeletal muscles, and also like central nervous system and hypothalamus, all these organ along with primarily the pancreas involves in the maintaining glucose homeostasis. Then what are the important reason that the blood glucose homeostasis need to be maintained? Okay. Glucose is a metabolic fuel for our tissue. So this basically produce like ATP or the energy, right? And if glucose condition is not maintained, if our body has like very low glucose, which is also called like hypoglycemia, like lack of glucose or hypoglycemic condition can cause severe seizure, and like it can kind of cut off the glucose supply to our brain, and we can also go to like unconsciousness or even to coma. So maintaining glucose condition and delivering the glucose to all the organs, especially to the brain, is very critical, because without the lack of supply of glucose, some of the organs may immediately get shut off. Chronic hyperglycemia leads to like diabetes mellitus. So if the glucose level is high, if the glucose level is too high, then we can like kind of see like a situation which is called like a chronic hyperglycemia, that can lead to like diabetes or diabetes mellitus. Okay. And so hypoglycemia is when glucose level is low, and if there is a condition where glucose level is always persistently high, that is called hyperglycemia. And as you know, like high level of glucose can damage the cells and tissue, so they can cause like retinopathy, nephropathy, neuropathy, like damages to the nephron cells, damages to the retinal cells, damages to the neuronal cells. So this sort of different diseases also can happen. So as you can see, like to maintain or regulate the blood glucose, like we really need like normal blood glucose level all the time in our body, and for that food can be like a supplier. So we can consume the food, and the carbohydrates can break down to like glucose and like fructose or sucrose. So this glucose mainly kind of maintains from like the food supply. What are different processes apart from diet? Apart from diet, like glycogenolysis also can happen, which was like, you remember, like glycogen to glucose, and this is done by the glucagon hormone, right? And also gluconeogenesis, like from like amino acids or the lactate, also can convert it to the glucose. So all this way glucose will be nicely maintained. But if the glucose level, for example, goes high, then what will happen? Then glucose can be stored for future use. For example, inside of the liver by the process of glycolysis, right? Like glycogenesis. So glucose can be stored in the liver by the process of glycogenesis, and it can be converted to the glycogen. and regular glucose in the process of glycolysis generally form like the energy. So, in process of glycolysis, glucose are being utilized in the cells and the tissues and maintain the normal cellular functions and our physiological functions, and also it can get converted to the lipid in the process of lipogenesis. So, glucose can be not only stored as like glycogen, it can also get stored as lipid for future use by the process of lipogenesis. So, as you can see, factors that cause like entry of glucose into the blood, it can be like absorption from the intestines, it can be glycogenolysis, it can be glucogenesis, or it can be hyperglycemic hormone. And what are different factors leading to depletion of glucose in blood? It can be utilization by tissues by the process of glycolysis, it can be glycogen synthesis or glycogenesis, it can be conversion of glucose into fat, or even like the role of hypoglycemic hormones. Okay, so these are various factors that can either increase or decrease the glucose level in our body naturally. So, let us see hormonal regulation for glucose homeostasis. As we said, the pancreas that release like two important hormone. The first one is the insulin, which we can also call like hypoglycemic hormone. Why? Because beta cells that secrete insulin in response to the high blood glucose, and insulin has two roles to play. First of all is it increases the glucose uptake by the GLUT4 transporter, right. So, for example, if I consider that we have a cells and that cell has a transporter which is GLUT4. Whenever the insulin activity happens, the glucose which is like free floating inside the blood, that gets uptaken inside the cell by the process of this GLUT4 transporter. Okay. And then it can also enhance the glycogenesis and store excess glucose in the liver. Insulin also inhibits like gluconeogenesis and lipolysis process. Okay, so these are the some of the functions of the insulin hormone. And then oppositely, during the fasting condition, as you know, glucagon, or which is also called like hyperglycemic hormone, that gets secreted from the alpha cells. So, insulin is secreted from beta cells and glucagon is getting secreted from the alpha cells. So, during fast condition, you will observe low blood glucose, and that time those stored glycogen will get converted back to the glucose in a process of glycogenolysis, and that way the glucose can be maintained in the blood, right. And it also promotes lipolysis or fat breakdown to provide alternative energy. Okay, so this is very importantly crucial hormone that plays the glucose homeostasis in the body, and in many cases due to this beta cell, either like beta cell destruction or like insulin resistance, we observe like a prolonged hyperglycemic condition, which is also called diabetes. We will discuss in couple of minutes. What are different other hormones that also can affect like glucose homeostasis? As you can see, like there are epinephrine or like adrenaline that generally released during the stress, right. It can also promote glycogen breakdown to the glucose. In this way, epinephrine can also control like glucose homeostasis. Then cortisol generally stimulates like gluconeogenesis, and also it promotes insulin resistance. Next is like the growth hormone. Growth hormone reduces glucose uptake by the muscles to prioritize like fat metabolism. Okay, and finally like this GLP-1 and GLP, which is like incretins, these also enhance insulin secretion from the beta cells and inhibit glucagon release after the meals. So these are few other kind of hormones that also have a role, not as like important as the alpha cells and beta cells that can directly like all the time control the blood glucose levels, but in a slow manner or in a lower level, these other hormones also can have a massive impact for maintaining the regulation of the glucose in our blood. that you can see this nice figure of the pancreatic cells, where you can see like we have beta cells. These are the beta cells which produces the insulin, and you can see also have like alpha cells that produces the glucagon. Okay, and these are like some other like acinar cells and delta cells. They are also very important to maintain overall glucose homeostasis, but primarily it is the insulin, right, that gets secreted by the beta cells, and the glucagon which gets secreted from the alpha cells. And this is the same homeostasis we have discussed. So you can go through this figure, that whenever the glucose level is high in the body, like insulin will be secreted from the beta cells, and that insulin promotes like two things. One is the glucose supply to the tissue, right, and second is that they can store the excess glucose inside of the liver by converting the glucose to the glycogen. Same way, when there is low blood sugar level or the glucose level is low, what does, like the alpha cells of the body or the alpha cells of the pancreas secretes the glucagon hormone, and this glucagon hormone can convert the glycogen back to the glucose. So this glucagon hormone can convert glycogen back to the glucose, and then in this way glucose can come to the bloodstream to maintain the glucose level in the body, right. So what will happen in case disruption of glucose homeostasis happen, and what would be different type of disorder we can experience. So first of all, we have to understand that whenever there is high blood glucose, we call this situation as hyperglycemia. Okay, what are different causes of hyperglycemia? It can be, as we said, it can be due to insulin resistance, or it can be due to pancreatic beta islet cell loss in the pancreas. These are the mainly two reasons why like hyperglycemic conditions are observed. Now this is like the condition of hyperglycemia is also called as diabetes, right. So the continuous or persistent hyperglycemic condition can lead to the disease called diabetes. And what are different type of diabetes? You can see there can be like type 1 diabetes mellitus or type 2 diabetes mellitus. In cases of type 1, as you can see that this is very typical type of disease, or also can be called as a genetic disorder, where it can be seen that our own immune cells can detect the beta islet cells as like a harmful cell, and due to the autoimmune activity those beta islet cells can be destroyed pretty early in the age. Generally it has been seen within like age 4 to like 10. Many of the kids or the childs can experience this autoimmune destruction of the beta islet cells, and due to that the pancreas would not have any more beta islet cells to secrete the insulin, that will severely hamper the glucose homeostasis of the body, right. And in cases of type 2 diabetes, what can be seen is like in lack of insulin secretion efficiency. It can happen due to like beta cell dysfunction. Along with that, it will also observe like a insulin resistance. So insulin will not be able to properly bind with the receptor and with the glucose molecule, and those can lead to like improper delivery of glucose to the cells and tissue, causing high blood glucose level in the blood and causing diabetes condition. Okay. Apart from that, lot of metabolic syndrome, for example like obesity, hypertension, and this type of thing can also cause like higher blood glucose level in the body. And next, when there is like low amount of blood glucose level, we generally call this condition as hypoglycemia. What are different cause? For example, if excess insulin activity is observed in the body, it can lead to like decrease in glucose from the blood, because as you know, insulin distributes the glucose, also stores those additional glucose. So overactive insulin activity in the body can reduce the blood glucose level, that can cause hypoglycemic situation. Or prolonged fasting also can cause hypoglycemic situation. Intense exercise, alcohol intake, these things also can cause hypoglycemia. What are different symptoms? We can have like a symptom of dizziness, and prolonged hypoglycemia can cause like unconsciousness, followed by even we can go to like a brain coma. Okay, this can be a very severe case, and if it is not treated properly, if like not properly immediately glucose level can be restored back, like a person may even die. So, as we said, diabetes mellitus is like a chronic metabolic disorder where persistent hyperglycemic condition is attained in the body. Globally, you can see almost 537 million of adults aged like 20 to 80 years are getting like this disease, deadly disease called diabetes, and this figure is ever rising. By 2045, like WHO is expecting that the number of patients can go as high as like 783 million. Okay, and as you see, like mostly there are two type of diabetes mellitus. One is like type 1 diabetes, second is type 2 diabetes. Apart from that, there can be like gestational diabetes during like pregnancy, right? Mostly like these are different form of diabetes that can be observed different time of the life. And this is like just a brief example, cartoon example. You can see like in cases of healthy, our pancreas or like especially like pancreatic beta islet cells and the alpha cells, they will like work and function in a proper controlled way. Whenever there is a high glucose level in the body, these beta islet cells will secrete insulin, and this insulin will be eventually kind of transport this glucose with it, and eventually this insulin will bind with the insulin receptor of the cells, and it will promote like the glucose channels inside of the cell, right? For example, like there are different glucose receptor or glucose channel like GLUT4, it can be GLUT1, GLUT2, GLUT3. So, by increasing the expression of these GLUT receptors or the glucose receptors, glucose will eventually be uptaken inside of the cells, and cells can utilize the glucose for energy production. Okay, but in cases of type 1 diabetes, what we said, the autoimmune activity due to like the autoimmune destruction of this pancreatic beta islet cells, all the beta islet cells will eventually die. And if all the beta islet cells eventually get destroyed, there would be like lack of insulin production, or there would not be any insulin production basically. And if there is no insulin production, there would not be any binding with the insulin receptor, which will cause like the glucose channels to stay closed or to stay like less active, and for that reason the blood glucose will not be able to come inside, right? So, this is very important. This happens during type 1 diabetes, and for type 2 diabetes we will observe either like lack of insulin like secretion. For example, like maybe you will see like only like few molecules of insulin secretion that would not be sufficient to deliver the glucose to the cell, or you may observe like insulin resistance. So, what will happen due to the insulin resistance, the secreted insulin will not be able to bind with the insulin receptor, and that can cause like eventually inactive condition of the glucose receptor, causing the lack of glucose uptake inside of the cells, and that means the glucose level in the blood will stay high. So, for both of these cases, glucose level in the blood will stay very high, and that is called hyperglycemia, or it can cause both type 1 and type 2 diabetes. You see like type 1 diabetes we already discussed, so we are not again discussing the thing. You can go through this, and in case you have further question, please ask us during the live session. We will be happy to kind of answer. So, what are different other risk factor for type 1 diabetes? Like mostly like autoimmune destruction that we have already said, and this autoimmune destruction are mostly kind of triggered by the T cells, right? So, mostly the T cells generally like attack our pancreatic beta islet cells to destroy all those pancreatic cells. And then it can be also the genetic factor, and it has been seen like there is a strong association of this HLA type of gene. Apart from that, there are environmental factors, for example like viral infection, and also family history can have an impact, and rarely it has been seen like in response to some vaccine it can also create autoimmune reaction. For example, I know few cases where the patient has been bitten by either a monkey or the dog, and they need like this rabies vaccine, and due to like after having the rabies vaccine within a few months and year, the patient like experience like hyperglycemic condition, and when they have been tested the cause of hyperglycemia, it has been found that due to the overactive autoimmune activity, all their beta islet cells were destroyed. So these are very peculiar. It is very difficult to kind of predict that when the autoimmune reactions will be overactive in our body, but it can happen mostly in the younger ages. And also we told about the type 2 diabetes, where mostly the patient experience the insulin resistance causing lack of glucose delivery to the cells, right. Mostly it happens to like the peripheral blood tissues that cause like increased blood glucose, and compensatory hyperinsulinemia, it can cause like excess insulin production initially to prevent the hyperglycemia. It can happen that the remaining beta islet cells will try to overperform and try to secrete more and more insulin to initially compensate the condition of hyperglycemia. But during this process, many of those beta islet cells eventually die due to like during those overperformance or the stress condition, and slowly there are loss of beta islet cell functions and lot of beta islet cells viability also. So all this can eventually cause a diabetes that eventually can damage the tissues and the existing organ. Okay. So what are various risk factors? You can see like obesity, insulin resistance, all this can be, and even like family history, age, lack of exercise. So all this can cause type 2 diabetes, and like mostly type 2 diabetes, but it can also contribute to some extent type 1. But type 1, as you know, like mostly it is due to like the autoimmune destruction, but type 2 can be prevented if we maintain like a healthy lifestyle with proper diet, with regular exercise. We can kind of maintain the physiological condition even if the type 2 diabetes happen. Type 1 diabetes is mostly like a chronic disorder, and if the insulin level cannot be maintained or the glucose level cannot be maintained in the body even after like insulin therapy, then the patient may even die. But with the type 2 diabetes, generally the lifespan is much longer. They can easily kind of control their blood glucose level with different intervention, and so that lifespan can be improved. So these are some situation you can see like during the fat state, and if we intake food, what will happen? Blood glucose level will be high, and as blood glucose level go high, the beta cells will secrete insulin, so insulin level will also go high, and then you can see like the ketone level can go down and the metabolic rate generally goes down. Okay. And in cases of fasting kind of state, for the balance, to maintain the balance, the blood glucose level goes down, the insulin also level goes down, ketones may go up, and metabolic rate generally go up to compensate the low blood glucose condition. So think about it, that how the prolonged fasting affect glucose homeostasis and what metabolic pathways are activated to maintain the energy supply. And next, why is the glucose homeostasis crucial for brain function? What happens when blood glucose levels become too low or too high? What role also liver plays in terms of glucose homeostasis, and how do processes like glycogenesis, glycogenolysis and gluconeogenesis, all this contribute? Okay, so hopefully you liked our blood glucose homeostasis and diabetes class. If you have any question, please drop us those questions during live sessions or in the comment section. We hope to answer all of your questions. If you want to further read, you can read like medical physiology textbook, right? You can read like all these one, or also you can consult like web content. So thank you again for attending this class. Let's hope to meet with you very soon with another new class of human physiology. Thank you.